I'm going to go ahead and get going. Um, we still have um, the $4,500, and we um, I'll be asking Tori um, to pay um, oh, what is her name? Sarah um, for the her work for our retreat. So and that's going to come up. The retreat will come up a little bit later, um, and there may be other people coming. So I'll wait and talk about that. We still have the one vacancy. I did hear from Annabelle that she was putting in an application, that we have a new supervisor there. Chris Kersey um, became the District 3 supervisor as of last Tuesday, I believe. So we'll have to, I think Becky is here now. And when you do the presentation to the board, Becky, remember that to welcome Chris as well. Um,
Yes, I will.
okay, thank you. The minutes for December 15th will be up to be approved at the um, meeting on the 19th, our regular board meeting. Um, board planning, the special topic will be local Sonoma Valley issues for East County. And I don't see anybody from East County here yet. So if Betsy and let's see, it's Betsy and Peterson, and who is the other person from East County? I'm not remembering right away, but if they don't show up this morning at the executive meeting, then I'll reach out to them and make sure that um, there's something happening.
It's Patricia Gray.
Patricia, thank you. Okay, so I know that Betsy is very active with these county issues, so I'm sure that she'll have some people presenting there. Um, I don't see Bill, so the budget transformation, Bill's report, when he shows up, he can give that. I'm going to put board planning, the retreat. When I looked at the doodle poll, it appears that the 23rd is the day that most people are available, January 23rd. So we'll plan on meeting on the 23rd, and the agenda isn't completely finalized, but I'm hoping that people have watched the 3 presentations that they were asked to watch, and we'll be discussing what our next steps are related to ACES, and um, what we can do to move forward and help the system move forward in that um, regard.
Kathy,
Yes.
I just want to add to information about ACES. I watch PBS a lot of the time, and there's been a lot of attention media-wise on ACES and trauma in this past month or two, and actually going back a little bit, but specifically the last couple months. just want to put that out there, that it seems to be, at least through national television, a nationwide movement of information, which is a good thing.
Yes, the awareness of it seems to be rising to the surface.
Yeah.
And I think, well, especially with the pandemic, nationwide, people are realizing the need for mental health services.
Right.
And then in our area with the fires and the flood and all of that, it's really definitely needed. So the 23rd, and in the, I believe that we talked about 3 hours being an appropriate amount of time to be sitting in front of a computer that's pushing it long. So I'm planning on a 3 hour retreat. And I sent out the roster of all the members with everybody's bio. So I don't think we need as much emphasis on, introducing ourselves to each other in the community. If anybody objects to that thought, that'll give us more time to actually get to the meat of the program at the retreat.
Is that currently, or is anticipated that will be part of the web page, mental health board page eventually?
The roster,
Yes. Well, the bio that
the bio.
includes, yeah.
Well, I don't know. I would.
I was wondering what the intention actually of putting it together if it's not a public document.
Yeah. It seems like it would be appropriate for it to be a public document.
Most boards do have public information that way, pictures and bios of who they are somewhere out there. I've seen it in the past. But initially it was for the Board of Supervisors to know who we were.
That's a good, yeah, I forgot that point.
Yeah.
And it's so, given that it has been sent to the Board of Supervisors, it's probably technically public anyway.
I think it's a part of their, their information that they put out from time, or what's available for people to see if they go on their website. Maybe that's where I've seen other boards.
Yes.
Photos and bios.
Yeah, San Francisco has a very nice site with that kind of information.
Most counties, from my time when I was attending COM board meetings in the past, that make up other counties, which I've brought to our board meetings in the past over the years, elaborate reports with pictures and bios, not only of the board members, but of staff and the MSHA programs, and real elaborate reports that we've not done. But so that public information throughout the state in different counties do it different ways.
So I think that the roster and the bios, I think it would be appropriate for them to be posted publicly. And I put pictures for those who provided them, and some pictures like Sherry's I got off of another site, but I did send it out, and everybody had a chance to object or contribute. So if your picture's there, it's there, and if your picture's not there, it's not there. So, and I do think that it can be published unless I hear major objections. So it will be then. Okay. Okay, so Bill's here.
Hello.
Hello. In the interest of your time, would you like to give us any updates that You want to?
Yeah, I think that updates that come to mind. So we are, right now the CSU functioning is struggling because both of our managers are out. One resigned unexpectedly for family reasons, and the other is on a leave. So if you know Sid McCulley, she's filling in there full time really, so not available to do her section chief work. The other business that's happening is so I'm starting to get some requests from the CAO's office for organizing the Measure O response in the planning. So I don't have any specific information to offer you, but wanted to let you know that activity is picking up in that area. So I would expect information to start coming out over the next month or two. Again, revenues start coming in April. Some of the revenue is already committed to parts of our budget. And so that will be reported, but it will, in an automatic way, go into the financial process. And then the new areas, we need to figure out how that's going to be, how the development of new programs is going to happen. So that's what they're asking for notes on. And again, I'm waiting for direction on that. The other vaccines are on everybody's mind right now because they are starting to roll out. We have Sid represents us on the vaccine planning committee. And if any of you saw Dr. Mesa's presentation yesterday at the board, you got an outline of how the tiers are organized and how the delivery of the vaccines is shaping up. I can tell you that for mental health, the CSU staff have been offered, and those who accepted received their first dose of the vaccine 2 weeks ago. And we're getting folks ready for their second dose. We have been asked for and submitted a list of all of the behavioral health staff who are having client contact now, others. So for example, in our community mental health clinics, and staff who would have contact with clients. And by staff, I mean anybody who would be in the presence of a client. So that involves administrative assistants and office staff, front desk people, anyone who would have contact with them. And they're projecting that vaccines will begin to be available to them in the next 10 days. So that would get most of our staff in the vaccination line. We're also submitting with that list the community-based organizations that serve our clients directly. So we're submitting all those names together and expect that they'll all be accepted together. And the delivery of the vaccines is still under development. So Dr. May shared in the meeting yesterday that the hospitals like Kaiser and Sutter are also vaccinating their frontline staff and maybe ramping up to offer vaccinations to others, but there's no definite information. The CVS and the other pharmacy I'm drawing a blank on is delivering, will be delivering this to long-term care facilities, staff and clients. And then it appears maybe there's a negotiations underway for Safeway for their pharmacies to be a primary distributor as well. So information will be coming forward on that. So I imagine we'll be reporting on this on a regular routine basis until everybody's vaccinated, and the information right now is changing frequently.
Bill, what about the clients?
So that goes with all the CVS long-term care facilities will get the clients, and then who are in programs. And then if you look at the tiers that Dr. Mace provided, I'm sorry, I don't have that to offer you right now. I put in a request to her. Well, I've asked permission to use the slides, and then we'll start offering them. But I imagine they're online through the board. And then our staff will fall into other our clients will fall into other populations outlined in the tiers. So you'll see a sequence of folks based on age groups, underlying health conditions, work situations, living situations. You'll see them all outlined in the different tiers. One of the things that's confusing about it is all of the tiers aren't in sequence, right? So we're not doing tier 1, and when that's done, we're doing tier 2, and when that's done, we're doing the next one, because every tier has a different delivery method. And they don't want to have people, there's no need to have everybody on the later tiers waiting if they're going to be using a delivery method not being used by the previous one. So different tiers are going to be activated concurrently.
I saw that similar to what you're saying on one of the news broadcasts nationwide.
Yeah, that came up a lot in the board discussion yesterday. There was some frustration about why do we spend all this time doing tiers when everybody's starting at almost the same time anyways. And what I took away from Dr. Mace's presentation is it's because it's the delivery method, and there's no reason for everybody on tier 2 to wait if Safeway is going to be the delivery method, and Safeway is not serving tier 1. Let's get tier 2 started at the same time.
Right.
Carol?
Yeah, I was wondering, I saw from the news that there is a breakout at Sam Jones, and I'm wondering if there is any mechanism to vaccinate contacts to prevent spread, especially in the homeless or high density shelters.
Yeah, I didn't see that in the presentation. It doesn't occur to me that strategy, because if you've been exposed, I don't know, because it's not my field, I don't know if you've been exposed, it does you any good to get a vaccination. But I will tell you from sitting in the audience, I didn't see that group in the tiers. I didn't see contacts as a group, but I could have missed it. There were a lot of different populations in the tiers, and like I say, I'm asking for a copy of the slides so I can speak from them from moving forward.
I had is there flexibility? I know that because of the cold storage issue, once the packages are broken open, is there flexibility to use up any vaccine that's left over within a time period outside of that tier?
So I've seen that happening in the news, like you have, when mistakes have happened, right? So when refrigerators have broken down, I know Ukiah did a come one, come all serve. I've not heard that we're having that problem here. I am hearing that and what I heard yesterday in the board meeting is the vaccines are going out to different distributors, and the distribution has been relatively smooth. They have been delivering the vaccine using all of the doses on the populations that have been identified in the tiers. So, for example, I know Kaiser has vaccinated. It was a very large percentage of their staff, because that's so frontline workers are in tier 1A, and so those vaccines went out to the hospitals so they could do their own vaccination of their clients. And I think Kaiser maybe was 70% or some very high percentage so far.
Any questions for Bill? Okay, so on the Measure O rollout, is there a committee that's appointed to work on that, or who is actually doing that work?
So that work hasn't really started yet. So the board will appoint a Measure O committee. That committee is, I'm trying to think of the words. They're not a planning committee. they're an oversight committee. So as I understand it, that committee is going to receive information about how the money is utilized and how it is expended. And so we have talked about meeting with that group once they're appointed, and they're not seated yet. Meeting with them early to talk about how they want to receive information and to let them know how they'll receive information, so that we're not waiting until after things have happened to give them information and have them respond to that. And then after that, all of the planning moving forward, if you look at the different projects, they're all very different, right? And they've not been given to DHS to carry out yet. Some of them may, some of them may not. And that is for the board and the CAO's office to decide. So we're just giving them notes now on, what do we know about each of the areas of the expenditure plan? What would we recommend regarding moving forward with that? And then we're waiting to hear back from them about that. We're waiting for our marching orders.
Yeah. So, Bill, is there a document that, or was there any stipulation about what the composition of the oversight committee would be?
The composition of the oversight committee is outlined in the measure.
Okay.
You'll see that they identify different areas like healthcare providers, et cetera, and then there are appointees from board districts and such. So the makeup is outlined in the measure.
Bill, you said that some of the programs are already in the budget. Can you give examples of what those might be?
So the plan roughly, the expenditure plan roughly allocated 50% of the funds for existing expenses, existing programs within the division, and 50% for new. So things like paying for residential care facilities for clients, that's been one of the big budget burdens that we've talked about in the last 3 budget rounds. Inpatient hospitalization, the CSU, all costs that are necessary, not mandated, and some amount of money has been was committed to that in the first round of the expenditure plan. And then I'll remind folks that the expenditure plan is the starting line. So that's where we've all agreed, or the measure directs us to spend each amount of money in each of these areas. There will be some kind of process by which the board may make decisions about changing the allocations. They can't change the categories. The categories in the measure are set, so you cannot add categories, but you can move money between the different categories in the expenditure plan. And so over time, we would expect there to be some kind of process by which the board receives feedback about what changes should be made and offers direction about doing that.
Where would would any of this affect the expansion of the MST, or be affected by that expansion?
The expansion of what?
The MST, mobile support team.
Yeah, so there's one expenditure plan line item that talks about MST and CAPE, which is the school version of MST. I think there's about $4.3 million set aside. So one of the questions I've sent forward, because I've been asked to begin to offer notes on that, is that someone needs to make a decision about how to split that, because those are 2 different programs, right? So how much of the 4.2 is going to be set aside for CAPE and how much for MST? So that's an example of a question I've put forward in response to the planning discussions that have happened so far.
And what about the peer centers?
So the peer centers aren't in Measure O. The strategy there is for Measure O to relieve pressure on the budget so that we don't have cuts that put peers in the way. The thing to always keep in mind is shortfall, and by shortfall I mean our ability to independently fund all of our work. We don't have all that money still, so the board has to, would have to continue to make some discretionary funds available for us to continue the work we're doing. So I'm hoping that we don't keep ending up in the dynamic we have been in, where we're asked to propose what would be cut absent any additional county funds. I've let everyone know, I think we've done this 3 times. I think it would be counterproductive to keep doing that. I don't know if there's any other option. But my hope is that Measure O offers enough relief we're not having to propose cuts moving forward. I don't know what will happen.
Definitely. I hope that's true. Carol?
Yeah, the 4.3 million that's been set aside of Measure O money for MST and CAPE, is that above the budgeted amount of 5 million over 3 years for the current mobile support team efforts to expand into District 5 and Saturdays and Sundays?
So I don't know. I mean, I make the assumption that the board offered that money for the 3 years of funding for that expansion. I make the assumption, but I'm not the decider, that that means Measure O money for MST would be used for something else, not for that, because that money's been committed. But again, I need to be cautious about how much I talk about this, because it's really, I've not received direction yet. So understand, when I say I make the assumption, I'm kind of in the same seat you're in, which is I'm looking at the information I have, and logically it makes sense to me. You wouldn't give 3 years of funding to MST and then say, let's put Measure O money in to replace that.
Right.
That would be an unusual move.
That is my concern, is that the budget as it has been passed includes amounts that was agreed upon. And Measure O, from my perspective as a public member of the public, is that is additional funds. Additional funds for those things that we wanted to have that were cut, that are going to be reinstated, like CAPE, or additional programs that we wanted and couldn't have because we didn't have the money. And my concern, as you always know, is from the peer perspective, if we are adding in additional programs at the expense of not being able to fund the existing programs, that's confusing to me. It doesn't make
understand. No one has suggested any of that's going to happen. During a recent board, yesterday's board meeting, Supervisor Corsi asked Director Robinson about supplantation, and she explained that it's our understanding that Measure O money is not going to supplant.
What does supplant mean?
I'm sorry, you broke up.
What does supplant mean?
Supplant means you can't say Measure O money is new money, so we're going to take back the money we gave you before and put Measure O in its place.
Okay, all right, that's exactly what I'm asking about. Yeah.
So, but at the same time, and again, so let's just be cautious about getting me in trouble here. At the same time, a purpose of Measure O was to deal with the fact that the county board has been giving us one-time discretionary money year after year that it can't continue to do. It can't continue to. That's one of the reasons we got Measure O, is because the discretionary funds aren't going to be available every year, and we wanted routine funding. So while there's a commitment not to supplant, there's also this dynamic of Measure O is designed to address the overutilization of county discretionary transfer of funds to behavioral health every year. I don't know how that'll play out.
Okay. Any other questions? Thank you, Bill.
Okay. Do you mind if is there anything else on the meeting you would need my input on? I'm getting a call I should probably take, and I'm gonna leave if there's nothing else you need me for.
Nothing else major. We've pretty much decided that the retreat is going to be the 23rd.
Right.
And
Okay.
that's
I
it.
did have one question about the SB 803. Will that be incorporated under MSHA or the new position, the cultural equity and WET position?
I'm sorry, I didn't understand the question. Do you mean who is going to be our project lead on implementing 803?
Yes.
Okay. Yeah, so the upcoming, that's not been decided. One thing is everyone needs to be involved. I mean, all of our management needs to be involved in it, right? This can't be one person, but at the same time, we need to dedicate some dedicated resources there. In general, we have a new position that will be recruited later this month that's going to serve, I don't know what the title is going to be yet, but their function is going to be to take charge of the workforce education and training projects we still have underway and help us focus on social justice, equity, cultural issues. And I can see this falling under that workload of paying attention to peer culture and incorporating that in our division. It makes sense to me it would fall to that person's workload, but the decision's not been made yet.
Where will that position be advertised, and how widely will that be advertised, and where will that advert be found?
It'll be advertised the way we've got a standard set of recruiting places. I don't have the list in front of me, but we're going to be doing some significant recruitments over the next, we are in the middle of significant recruitments, and we will have more over the next couple of months. And this position is in that list, but we will also be opening section chiefs for youth and family and adult, looking to add some program managers as well. This position's a significant recruitment, so we will be utilizing our standard recruitment package, and then I've asked them to add Indeed because I'm told that that's the site everyone's using these days. So I've asked them to add Indeed to our recruitment.
Thank you.
Excuse me. Thank you, Bill. Go take your call.
All righty. Thank you all. Good to see you. Happy New
As
Year.
well. Thank you.
You too. Okay, so the Mental Health Board presentation to the Board of Supervisors is January 12th. Becky's going to do that. I don't have readily available, although I can get it to you. The Board of Supervisors actually has it's kind of an application to present where you actually do the bullet points that we were talking about. So Becky has that to go off of, and with the addition of welcoming Chris Kersey, I think that that's pretty well laid out. Becky, did you have any questions about that you needed answered now, or you can contact me privately? But basically, on this first round, I gave them the 2018 annual report, the data notebook from 2018, and the there was one more annual report, data notebook. I'm forgetting that last one, and the roster. So those things are, I will send that out to you, the application, so that you can see what Becky's going to be presenting.
So also the bio list,
bios.
is that what, yeah, okay.
Yes, the bios are there, and there was one more. Oh, and I did one of our next things was or number 6 was talking about whether the Board of Supervisors could come to our meetings. And so I included that in Becky's presentation, just the question of whether changing dates, our day to meet, would allow them to come to our meetings. So it's not something that's an emphasis in Becky's presentation, but that question was asked.
Kathy?
Well,
Yes.
go ahead, Sharon.
Sorry, do we know what time of the day we're on the agenda?
I don't know that that's put out yet.
Okay.
Bob, did you have a question?
Well, I was going to say, hopefully I plan to attend, and it would be useful, beneficial if others from the board, mental health board, were also able to attend, and we could just introduce ourselves, at some point, just so they see some faces.
That's why I was asking the time.
Okay, so
Think as well.
perhaps if you are planning on attending, and in case Becky doesn't notice that you're present, if you can let Becky know that you are there, so that she can take the lead in talking, but then make sure that you're introduced during that time. Okay, so are there other reports?
I just would say, I noticed when I was looking at the COM board site the other day, last week, whenever it was, I looked at it. The secretary had passed away, and she was in charge of setting up all the meetings and everything, and was part of the glue that created such a great transformation of that organization. So I just wanted people to know that she was a wonderful lady, and a family member on her local board in Shasta area, and greatly missed by the COM board. Will be greatly missed in her community and our larger community as well. Just wanted to pass that along. And to be just a reminder to look up, to look that website up, because there's always great information and links to information and links to other counties and what they're doing.
There's a wealth of information on that website.
Yeah, it's great.
And we do pay to be members, so it's worth
Right.
looking.
What website? I'm sorry.
The COM board, CA.
California Local Association of Behavioral Health Board
and
commissions.
Yeah. CALBHBC.
Right. Yeah. Yay.
Okay, Kathy,
Bob?
Yeah, I sent out information concerning the site visits and sent the forms and what we need to complete. I heard from Becky, who would be willing to do one, but I haven't heard from anyone else.
Uh-oh.
The goal would be ideally 4 members conducting 5 visits, which would mean 10 visits or a visit every other month, every month except July or December. But if there's not much interest, then there's no reason to even conduct them because you can't get a critical mass. So
Right.
anyway, just whatever. It's just the way it is.
Yeah, I apologize that I did not respond. I'm wondering who would be setting up the visits, and
I
how would
asked-
we know?
I'd ask help from Tori. I'd contact Bill and say, can he give us some sense of priority of what sites to visit? It would all be done via Zoom, and then we'd schedule them. I'll work with Bill from the priority list, work with Tori about the mechanics of setting it up. You're talking about maybe an hour time. So,
Yeah, and I responded to Bob's email, also requesting, or I guess offering Latino service provider as an option because they have a presentation already complete and ready to go for us to learn more about their programming.
Okay, and Betsy, on January 19th, it's the East County presentation. Have you been successful reaching out to anybody to present East County issues?
I have not. So January, sorry, January what?
20th?
20th?
19th.
19th, okay. And I should reach out to service providers, MSHA grantees, I'm assuming, right?
Right.
In our area.
Yes, anybody who provides services in your area that either we pay for or we would have an interest in. For example, there may be, like if there's a hospital or health center that does provide mental health services, those are clients that we would be interested in hearing about the services for. And the I know that the Latino population in East County is strong.
Yeah.
So maybe some of those providers.
Obviously, La Luz.
Yeah.
Yeah,
Love
I
those
remember
things.
doing a presentation a few years back.
Okay, perfect. Okay. Anything further on the jail, Bob?
We do have
yeah, I need to defer to Carol on that.
Okay, Carol.
On the jail update, Carol.
yeah. So Sid McCauley gave us the name of the current person who's in charge of the programming for mental health. And his name is Robert Travelstead. And I said that I would follow up. He did return the email, and I said I would follow up with him early January. So, this week I'll send him an email and hopefully we'll get to meet him.
Okay.
Yeah, I got the name of Lieutenant Cleek from Eddie Ingram. And I emailed him back in November. I never heard from him. But then and Carol got another name. So we're waiting to see if we ever get a response.
Yeah, because I think my understanding is that Lieutenant Cleek is in charge of the infrastructure, the building, and that Robert Travelstead would be in charge of the programming.
Exactly.
So it would be nice at some point to perhaps have them both come and visit and give us a little update, but we're not there yet.
Okay. So I want to come back to acknowledging the behavioral health staff because we do have some time to discuss it, but I want to, I'm realizing that I know that we have, March is the presentation that Wendy and Betsy were going to do, correct, Betsy? Yeah, but
Yeah.
February, okay, go ahead.
Yes, I think it was going to be in February after our retreat, just so we figure out where to go after our retreat.
Okay, so it's going to be February?
Mhm.
Okay. So that was my question. I had thought it was March, but February is good because I couldn't remember anything else being in February.
Yeah, and in March, we were hoping, I got confirmation from Doctora Daniela Dominguez to come in and talk about, implicit bias and, the topic that we had discussed prior. So
Okay.
She's available March.
She's in March, and is that for a regular mental health board meeting presentation?
I think that's up to the group here to decide that. It depends. She would only take 2 hours, and she's very dynamic. So I don't think those 2 hours will be felt at all. It's going to be a great presentation, I'm sure.
Okay, so the
Sorry, I didn't get the topic name again.
the topic.
Yeah.
Okay.
Yeah, well, it's anti-racism, in mental health. There's different components that we talk about amongst that, but implicit bias is always one that is talked about and covered.
Yes, I just couldn't understand you when you said it fast. I didn't catch it.
That's my Latina side.
I got it.
Okay, so
So
just help me understand, do we have a presentation in February and in March? Are we paying for both those presentations?
no, not the February one for sure. And March, I mean, 2 hours is more like a retreat type thing where we would have, take some time to do that. We don't have a presentation for our regular March meeting. So, if she wanted to do a shorter presentation during the meeting, that would be great. Or we have to come up with a March topic.
Okay.
So, Bob?
We have such as when the elder suicide presentation was done, I believe what we did was had a very abbreviated mental health board business meeting, and then the presentation, and it may have actually been overall maybe as much as 2.5 hours total. Maybe the first 30 minutes being taking care of board business expeditiously and then going into the program. I don't know that it actually went 2.5 hours, but I think we had somewhat allotted that time, as I recall.
Yeah. Would that work, Betsy? Something like
Yeah,
that?
so I know for her, it's going to be less of a presentation, it's more of a facilitation. She always draws in the folks that are listening to the conversation to be part of the conversation and the learning process. So, I could always ask her to see if it's possible to do a shorter presentation and see where we go with that. I'm happy to ask.
Well, okay, so Bob's idea, if you're saying 2 hours, Bob's idea of having that, be the meeting is a possibility as well. And is that so that her facilitation then,
Mhm.
to Carol's question, is that something that we would be paying her for?
Yes.
Okay, and do we have an idea of how much?
Well, I gave her the budget the same, I kept it to the $1,000 and told her that's what we could pay. That's our spending limit for that sort of presentation.
Okay. So that is a discussion that's more appropriately done here in the executive committee than the timing of the other was that we just did it in the regular meeting. But
Right.
is that
Right.
something that,
I think I saw the email that you sent with Sarah Rock's outline. And my sense from the process that we went through for that was that initially she quoted us a very much larger number. And once we'd explained to her what we wanted and what we had for budget, it came in at less than half of what she'd offered originally. So, you know, I don't know this person, Betsy. She sounds awesome. But what I'm hearing is that she's offering to facilitate a 2-hour process. I think from an accountability perspective, I think it might be a good idea for her to do something similar in that she tells us what she's going to do during that time. And, you know, that we have some way of accounting for why we spend $1,000 on this particular person.
Sure, yeah.
You know, what expertise is she offering? And, you know, I think it is a topic that we do need to cover, and it sounds like she has expertise in the subject matter.
Mhm.
But I'm kind of a little alarmed at the kind of, it feels like we do not have a process as a board for deciding who our speakers are going to be or how we spend our money. So that's really what I'm speaking to at this point.
So Kathy, I'm
Yes.
sorry, I don't remember what, for our retreat, what's the cost of our retreat? Is that,
the retreat is 1,000.
okay,
We had that discussion very publicly at the last board
I-
meeting.
right, but I didn't,
Yeah.
I wasn't there.
And
yet, so.
And she had originally, I think it really was my fault that I really hadn't given her any figure to work with before she presented her her proposal. And so it came in much higher than I was expecting. And that's, you know, that was the discussion there. So we agreed to, at the last board meeting, we agreed to spend $1,000 for Sarah. And we also talked about having this person that Betsy knows come and talk about the, you know, racial inequality and disparity. So I'm sure that that's, you know, the $1,000 that Betsy was, you know, talking about was that we
Right.
had talked about having a second person, and we do have 4,500.
Right.
So, you know, I think that it's legitimate to know what she's talking about and what we're getting for that money. So I think that we should put this, Tori, on the February agenda to, you know, really discuss it and come to some final decision. But Betsy, if you could have her write up some sort of a proposal. I
You
think that the racial disparity is definitely something that we have not addressed enough. I think that it's as important as the ACEs. So
Yeah.
And I think if we, I'm not sure who mentioned it last time, if we if we think about it in terms of us going to a conference and what the cost per head is to attend a conference, I think it's a reasonable amount to pay somebody to do a 2-hour training. But I think we do need to have logic behind it. We need to be able to be accountable for what we spend and why we spend.
Absolutely.
Okay, so let's think about Bob.
Well, I think that Betsy possibly might, since we have a little uncertainty, it might have the speaker formatted from some sort of structure from perhaps from 90 minutes to 2 hours, somewhere in that range, and see what type of program she might be able to offer. And so we have a better sense of that. It's not necessarily a firm 2 hours because of we'll be doing some other business, but hopefully we can publicize it and get more of the general public or professionals in who are not on the board to attend. So it could be very effective. But I think if we get something substantive back, an outline, and let her know that it's going to be some kind of range, 90 minutes to 2 hours, depending on how it goes. Would that work, do you think?
Yeah, absolutely. I will let her know. I do think in our previous conversations, I think that we all agree, like Kathy said, that it's a very important subject. I also feel that our communities and our constituents would be, hopefully they will be engaged in attending this presentation themselves because of who the speaker is and because of the subject matter, just everything that we're facing, and the fact that we as a board are learning about it as well and taking initiative in the subject is, I think it's really important. It's really telling for our community to know that. But yes, so I will absolutely do that.
And maybe a flyer, or if you have the information, I'd be happy to help with the flyer. But yeah, I think that helps in a JPEG form that helps to distribute on social media.
The what we did with the elder suicide program was
I see it
utilize the services of the, I guess, public information person with the behavioral health department, and they sent out to the media and agencies and so on. They had an extensive list to try to get the word out.
Yeah, I just want to concur with all the conversation that for our Latinx community to know that we care about them, that we want to hear them, that we're working, we're trying to work to meet their needs, is really important. And you know that, Kathy, you and I have been, we put a few years into this, and it's really exciting to have somebody on the board that's a real direct connection now. So it's great.
Yes,
Thanks,
this is the first, really.
Yeah.
Okay, so Betsy, if you can get that information, and we can aim for March in possibly, like Bob was saying, we met at 4:30 to get board the necessary stuff out of the way, and then had 2 full hours. So we can do that, or we can see how that works out for her. And we should talk about February. You and I talk about February, because originally we had talked about having a quick board meeting before the presentation. So do you know, are you and Wendy planning on doing the full 2 hours from 5 to 7, or?
I believe so. And what the structure of it will be that she is facilitating the conversation. She's going to have a panel of folks involved. I have the names if you want me to I have the names. Let's see.
I think you said Sean Bolin and Sean Kelson.
Yeah, there's Sean, yes, and Hannah Institute, and I believe someone else. And so, and we hopefully, depending on how the conversation goes with Sarah Rock, we're hoping to narrow in on policy change and in how this board can influence that. But like I said, we're going to follow up after the presentation with Sarah, after the retreat with Sarah Rock, and then proceed from there. So we're not, duplicating. And yeah.
Okay, so the only thing that we would need to know is whether we're going to have whether that presentation will take up the entire 2 hours and we have to add a little bit of time on the beginning or not.
Okay.
And it's the February meeting, so we could make that decision, at the next executive committee meeting. But we need to know. Carol, did you have a question?
Just a suggestion that maybe for March, that we contact someone at KBBF, 89.1 radio, because I know that they have had in the past, I don't know if they still do, they have community members come and talk about particular programs. Maybe we could have a slot, 10 minutes on one of their community outreach talk shows.
Yeah.
Talking about the mental health board, and in particular this particular event that might be of interest to them.
Okay, Betsy's definitely nodding. So
Yeah, no, I love that idea. And I have a contact there, so I'm happy to connect.
Okay, perfect. Okay, any more on those 2 meetings? Okay, what have we
Tori
got?
has her hand up, I think.
Who?
Tori, I see a
Tori.
hand. I don't see her, but I see a hand up there. Whoops.
It must be accident. Sorry. No, I'm good.
Okay.
Okay. Okay. Let me see. What have we not covered? I don't have a chair report. There's no conferences to attend. We just talked about that. I think that we talked about, well, we haven't talked about topics to add to the agenda, but I think that we've covered the next couple of months. So the only thing on here that we haven't talked about is acknowledging the behavioral health staff. And I know that, we keep talking about it. Excuse me, we keep talking about it. But the real question is, how would we acknowledge staff, and would we be acknowledging, a group? Maybe we just figure out who it is that we want to acknowledge, and then do, like one unit at a time. And I know, Sherry, you were thinking of things like cookies and
Right.
food.
That was before we got really into this COVID situation.
Yeah.
Yeah.
So maybe just some sort of an acknowledgement at the board meeting.
I actually woke up the other night thinking about this, popped into my head for some reason, because I've been thinking about it off and on over the last month. We could write a general, it's really, in some way, a thank you to not only the Sonoma County behavioral staff, but all the mental health, emotional health folks in our community, through a letter to the editor. That doesn't cost anything. And it won't get to everybody, but it'll get to some people, either online or through the actual hands-on newspaper. But I just think as we've moved through these many months of the COVID situation and the racial turmoil that's been throughout our nation and still ongoing, and right now. I'm looking at what's going on at the White House. It's just pretty scary and pretty timely. And I think it's important to acknowledge everybody that's working in our community to help, or, you know, just a general kind of, if you're, that I keep seeing, especially around suicide and other issue, depression and stuff like that, a hotline number, and just kind of through that letter to the editor, a reminder to everybody that there is help available, and the hotline numbers. And I don't know if probably would take all the words to list all the nonprofits and all the organizations that are available to folks. But it's important that they know that there is help out there.
Bob?
I'm not sure if I missed it. Was there a time frame for acknowledgement? It is 4 months off, but May is Mental Health Month,
Right.
and that might be appropriate time. I was thinking if we're talking about a letter to the editor, possibly a combined effort to do a closer to home column for the beginning of May might have more impact and allow for more information to be shared, and allow actually any signatures on that column. So it's just a thought.
It's a good thought. Thank you, Bob. Yeah, because I think that actually allows for more words as well.
Right.
Would somebody be interested in working on writing that?
Mhm.
Well, we've got 4 months, so we might want to
Yes, we
just
do,
kind
but
of.
it goes fast.
Oh, well,
Yeah.
that's very true. It seems
Yeah.
to go faster now that we're more sequestered, but
Right.
you know, maybe we could throw ideas into a pot over the next month or something like that, and then maybe they would tend to coalesce, and people might choose to step up and work with that.
Bob Hales?
What if we devoted each mental health board meeting to just a little thank you, an agenda item, and select, you know, particular staff that we want to acknowledge for special contributions. So it'd be a regular agenda item, wouldn't just be a one-time, it'd be on a regular basis.
I like that idea.
That's a good idea. That's a good idea too. But I think to reach out to more, it's a great idea, Bob. But the other Bob too, I think it's really important to reach out to our broader community, because there's so much misinformation and out there that there is no help, especially through the county. But there's a wealth of help through the county, but also through the other nonprofits and individual providers.
Oh, I was implying be restricted to county mental health employees. It'd be anybody who provides services in the county.
Right, but I mean, there's not that much, the broader community doesn't attend our meetings to hear that public acknowledgement.
Yeah. I think we could do, you know,
Both.
yeah. You know, and a letter or an article. I know somebody who's connected with the Argus locally in Petaluma, but I think probably the Press Democrat would be better in that it's got a bigger distribution.
That's a closer to home. I think the Press Democrat is the closer to home column.
Right.
And every paper has a letter to the editor place. But I think the closer to home is a better idea, because it is. And I think it's a good, if we each member of our board would want to sign off on it, also would be good PR for the community, for our larger community, to know that we are here, we do care, and we, you know, we hold mental and emotional health really close, and there is a difference.
So Sherry and Bob, I'm aiming this at you, I think. Do either of you know how to get a close to home article in to the paper?
It's something like sending a letter to the editor. However, it can be longer. and it should be submitted several weeks ahead, just to try to ensure that it's going to be accepted. And I think that's, kind of, it's a process. If you go to the Press Democrat opinion, I think there's a little paragraph that talks about submitting to that. And I don't, are most of us familiar with that particular with that particular column? Okay. It's actually a column. I think you can go to 450 words. That's on the opinion page, a separate linear column that's called Closer to Home, and it's on any number of topics from different groups or individuals that have a particular agenda. Perhaps it's on climate change or other social issues or whatever. So I think it would be a separate thing, but I like both ideas. I like Bob's idea as well.
Right.
Yeah.
I think the timing of it to be published in the paper during May is quite appropriate for our board to submit a Closer to Home information on what, and by then also, as the months, judging from what Bill offered, as these next months go forward, we'll have, I don't even know who's staff anymore. I don't even know. I haven't heard, we haven't heard from Scott's case manager for months. And so I don't know what's going on within the system right now. So, but I'm hearing that hiring of staff is part of the process that's happening right now. And I like hearing that. So we'll probably have more information by May of the section managers that we can name, if they want to be named, but at least that we know that we do have sections within the division that are up and running.
Could I just jump in really quickly on this topic? I think about the headline song, Who You Gonna Call? How many times have we had families come into one of these executive committee meetings or even to a public meeting saying what a struggle they had, what a circuitous path they had to take to find out where to get help? Who do they call? Whom do they call? I've had a number of neighbors in my side of rural Petaluma contact me because they knew I had been a social worker, talking about things that they were seeing with their kids and what to do. Fortunately, at the time, I knew the guy who was the head of Children's Services, and I could get a door open, but not everybody can do that. And so if we could, if there's a way at all, and it's such a convoluted path, but if there would be a way to have some kind of a nice, almost a line drawing or something of what to do when you see this with a family member or a friend, and what phone call do you make? And then, of course, is that phone call going to be answered? Sometimes it seems like that's another complaint that comes in. I'll be quiet now.
Thank you, Marianne.
Yeah, thanks. And that's something that I think, that's access to services has been an issue, and how to find out about the access has been an issue that I know that has been worked on. And I think that we've got a ways to go, but I do think that the system is trying to do that. Carol, what did you have to add?
I see that Erica Chloe is still with us in the meeting.
Yeah.
And she might be able to, if she's willing, kind of let us know a little bit about the work that she's been doing to help with resources. And
Yeah, she requested to speak, and so we've put her able to speak. So Erica, did you want to go ahead then?
Hey guys, can you hear me?
Yes.
Yes.
Yeah. So I was just had wanted to just say in agreement that I think it's great that you guys are looking at, informing the public about the work that's being done and the support and services that are being done in our community. I think it's really important, especially as we move into more and more of the community being challenged with things that they've never been challenged with, losing their jobs, homes, et cetera, family members. So I just wanted to say that, and also just recognize that our poor system, as we all know, has been through multiple disasters. And so that means we've been in disaster response in and out for many, many years. And I think that's just, if you guys are thinking about writing about that, I think that really needs to be included. And there's many people, especially at the county, that have stepped up into roles in order to help support that effort. And so I think that I really just liked that Sherry was including our whole community, because it takes our whole community right now.
Right.
So that was what I wanted to mention. And then I don't know what specific work you guys are wanting me to talk about. Are you speaking, Carol, of Path to Hope Live, or what were you thinking you wanted me to share about?
Just the efforts that you do on a weekly basis with the community collaboration around COVID, specifically how the agencies had to modify or change or the way that people can access programs. But even the documents that's available for people if they call 911 and their loved one has is in crisis. I just think there are so many resources to come up, how to share those resources in a logical way that's not overwhelming. Kind of maybe the first point of contact, or maybe a website that has a lot of these resources listed, maybe just listing some of the more immediate emergency, suicide hotline, the county form line, might be two that you include in the article, but a place that people can go or a person that they can speak to. I know that the Redwood Community Health Coalition, they have their equivalent of 911, not 911, 211, and 211 itself is a huge resource bank. But it's almost like, if I was a family member with someone in crisis right now, it's almost like you need someone, a person to help listen to you and then talk you through and then kind of head you in the right direction. So how do you do that in an article? How do you get people to that first open door?
Mm-hmm. So you're talking about the system access points, right? And that is a complicated conversation, and it's hard to, make that simple. However, there are, starting points, and I think it's a larger conversation than the 10 minutes that we have. I'm happy to talk more about that, and we've definitely been working collectively as a community. So we have many different community partners across lifespan, serving all of our different populations that come together to talk about community resources, which is what Carol's talking about. We have all of the major platforms there, 211, NorCal Resources, the system navigators that are working on our system that help people navigate through the system. They come in a lot of different, we have a lot of different names that we call individuals that help and support our community. So community health work, peers, et cetera. So I think that's just a longer conversation.
Kathy, I don't want to, I just want to break in right now. I have this stuff that's going on in Washington on mute, but I'm just looking, our House of Representatives have evacuated because the protesters are in the Capitol building. So that just points to, I'm 75 years old. This had never, my dad's 96. This is just unreal. So I can only imagine what folks are feeling out in our community, isolated and seeing this. This is just unreal. So the high anxiety for some folks, and especially some of our clients and stuff, it's quite appropriate that we're having this discussion right now, that we're trying to find a way to reach out to the community, all of our community, all the ethnic groups, all the cultures, everybody, that that it's going to be okay. But this is just unbelievable.
Yeah.
Unbelievable to have the House of Representatives evacuate in the midst of taking care of their business.
Yes. It's mental health is definitely at the top of everybody's list at the moment. So I want to get back though to acknowledging people, and I want to keep that one, but
Right.
I have a question for Tori. When, like, Erica just put a link into the chats, how is that captured in the recording, or should that link be acknowledged verbally?
It's both. It is captured in the chat of the recordings, but I can also add it to the minutes if you'd like.
Yeah, why don't you put that into the minutes? Because
Right.
that's a suggestion. And she suggested that we look at www.socdetencovid.org. So yes, put that in and we can take a look at it. So I think that it's a good idea both to acknowledge people or programs on a regular basis within the meeting. And I think that we can put that on the agenda. However, we haven't picked somebody to acknowledge this time, and we're running short. And I do think that it's a good idea to do a close to home for May. So if Bob Cobb, would you be willing to look into and start, be kind of the person that is in charge of getting that, taking people's ideas and putting that together?
Yeah, I'll, if people want to contribute thoughts, and I'll look into what the process will involve, and bring it up again at the next, I guess the next executive committee meeting next month. I can do that.
Okay, thank you for doing that. And I think that we, if we're going to acknowledge somebody, we should actually figure out how we're going to do it. If it's a program, are we going to have some sort of a paper plaque or something, acknowledge, some sort of, how are we going to acknowledge them? Is it just going to be verbal, or are we going to put something together? Sherry?
I just right now at the top of my head, I would say it's Sid McCauley should be number one. She just seems to be the glue that's holding everything together right now. But so that's a name. But as far as the process, then I don't know.
Yes, and she has stepped in multiple times, as have many others, but Sid is
right. But she's a name that keeps popping up everywhere.
Yes, she does.
Yeah.
So
Kathy,
yes.
this is Becky. I just wanted to make sure that you saw that I'm certainly not married to the idea of the specific program, but kudoboards.com is an example of a group thank you that can get very creative and, full of graphics. And so each member of the mental health board can be a part of it, almost like a bulletin board of sorts, and all personal kinds of thanks and gratitude could be put together into one larger file that then is accessible electronically to the recipients.
That thank you for pointing that out. I think I saw it go by in the chat, but I hadn't. I appreciate that you verbalized that. So we need to look into that, because that would be a good way to do programs and people. Yes, Carol.
I was just wondering, I just appreciation for all the work that Erica's doing. and the multiple groups that she's connected with. And wondering if in Mental Health Month, I know there's always a lot going on, but perhaps some form of, I don't know, an event, or perhaps a topic at our board meeting about access, open doors. I'm not sure what it would be called, but I think it's just tragic that people are still struggling to find, an access point when there are so many resources. And I know that there's this ongoing, and Eric has already said that it is complex, but I'm wondering if there's, between now and May, we could think about, how to help people find the right door or the right person or the right agency when they need.
Yeah, it's a huge issue, and it's really, it's pointed out to me in that when I should know as aware as I am of the system in general, I should know where to go for a specific issue. And every time that somebody talks to me or asks me, I actually have to think about where to look. And so for me, the question is, how do you find, like Erica was saying, it's a large issue. How do you find the spot that people will go to look? So maybe we should aim at May, that being actually a topic that we address.
Yeah, it could
Can I comment, you guys? Would that be okay?
Yeah, go ahead.
So I love this conversation, of course, because this is definitely one of my favorite things to talk about. So I would lean towards what we know to be true as a community, that people look for and find what they need, right? So that's about self-efficacy and empowerment, and that's the peer perspective of supporting people to have access. The system is very challenging, and it's difficult because there's multiple populations and multiple different ways that you could actually find and create a network of support for yourself, right? And so the one size fits all does not exist, which we all know, which is why it's a complex system. So to have that conversation, I think the focus could really be around, what are we doing as community to support decreasing the stigma so people do find the choices that work for them? And then also, how can we decrease those silos or barriers and increase that prevention is what I think you're really trying to address. And I think that's a really great conversation. And I think the more we have that conversation, then the more people can find out what choices are available. And then we can also look at where do we need to move in a different way to create more of a net for our community.
Perfect.
Yeah, that is kind of perfect, Erica. Maybe we should have you speaking in May. Bob?
Backing up just a bit, going along with Bob Hale's suggestion, if we're going to be acknowledging specific segments at each of behavioral health departments, community service providers, so on, we might want to tap into, say, Bill Carter or other key individuals so that we don't overlook any particular segment that might not be that obvious to us that is providing valuable services.
Okay, so I will talk to I'll talk to Bill and see about getting that. But I do think that it's a good idea to acknowledge Sid this next meeting, and I'll figure out how to do that. Probably with some sort of a certificate, and then get a list from Bill so we can start working on that. So it is 12 o'clock. And I think that we have spoken about a lot, and that we are done for today unless somebody else has something real pressing.
Thank you. I didn't mean to interrupt what was going on in Washington, but I'm just flabbergasted.
Move to adjourn, Madam Chair. Gotta go turn on CNN. Thank
Yeah.
you.
Yes.
I'm actually
Okay.
watching NBC.
Thanks, everyone.
Okay.
Thank you. Take good care.